Hi, today I'd like to talk to you about a rare condition that is very similar to morning sickness. This condition is known as Hyperemesis Gravidarum. Now, why I compare it to morning sickness is that it is a very similar symptoms, only that hyperemesis, the severity of its symptoms are far more severe. So hyperemesis is a condition where the mother experiences severe vomiting, nausea, insomnia, dehydration, malnutrition, excessive salivation, and so on. There are a list of symptoms that she experiences with this condition, and all of which prolonged and also happens throughout the pregnancy. So it is very difficult for her to sustain her pregnancy because of the immense and unbearable pain that she's suffering throughout the pregnancy. So the most distinct symptom of hyperemesis is the excessive vomiting and also violent vomiting. She may even vomit the contents of her stomach, of blood, and even bile. So morning sickness is quite similar in this case, only that it is much more mild and not harmful at all to the pregnancy and the baby, and it is considered a normal pregnancy symptom, whereas hyperemesis is very, very dangerous and can both threaten the pregnancy and also the life of the mother if not treated as soon as possible. So the main cause of hyperemesis is not known to many medical institutions, which is why there are not many places that can treat this condition effectively. And here at Antai Hospital, we have identified that the cause is actually due to the hypersensitivity or allergic reaction towards the pregnancy hormone itself, which is HCG. So HCG is, as we all know, is a very important pregnancy hormone secreted during pregnancy in the mother's body. So these women who have hyperemesis, right, they have a very unusual allergic reaction that happens towards this HCG. The body is rejecting this HCG hormone and then producing these types of very severe symptoms. So here at Antai Hospital, our treatment for HCG is that we have a HCG desensitizer that can work to neutralize this allergic reaction. And then depending on the severity of hyperemesis that you have, we will give a much more stronger dosage, depending on how severe it is. So hyperemesis, the desensitizer treatment can be given either orally or via injection, and it is proven to be very effective, and results can be seen almost instantly. And do not worry, it will not harm the development of the baby. So if you'd like to find out more information about hyperemesis, please refer to the article link in the description box below. If you have any questions that you have, please leave them in the comments below.